Hello everyone, welcome back to Exam Geek on Dentistry. In today's video, we will understand ANUG-Acute Necrotizing Ulcerative Gingivitis in a very easy English. We will cover definition, nickname, causes, signs, stages, diagnosis and treatment. So let's start. What is ANUG? ANUG means acute necrotizing ulcerative gingivitis. So definition means acute disease with a repeated remission and exaggeration which is seen with an impaired host response characterized by death and slogging, that means shedding of the gingival tissue. So it is an acute painful gum disease where the gingiva start dying, and slogging off. So it occurs in a repeated attacks, meaning symptoms can come and go. So it is an ulcerative lesion which is non-contagious, that is non-communicable. So what are the nicknames? Nicknames of the ANUG is trench mouth, Vincent angina and Vincent stomatitis. So you should remember these names for the exam. So what are the predisposing factors? That means causes. People usually get ANUG when their body immunity is low. So what are the important factors? There are smoking, injury to gingiva, pre-existing gingiva, so that means pre-existing gingiva, nutritional deficiency, psychological stress and GIT disease, that is stomach or the intestinal disease. Physiology. So let's understand how ANUG is developed. So first one is psychological stress and anxiety. So it will lead to increased corticosteroid production. Then there is immunosuppression, that means low immunity. So plus viral infection and poor nutrition will result in bacterial growth and invade the gum, that is increasing the bacterial growth and invasion, which will lead to necrotic ulcerative gingivitis. So this one is pathophysiology. So signs and symptoms. Patients show very clear symptoms. So first one is, it is really extremely sensitive to the touch. There is guaning pain which is constantly radiating. Painless is intensified by spice food and the hot food. There is spontaneous bleeding from the gingival tissue. Patient may feel of metallic taste and having of pasty saliva. Punch out crater-like depression present at the crust of the interdental papilla, and teeth are slightly extruded which is sensitive to the pressure. There is woody sensation, fed odor and increased salivation. So these are the signs and symptoms which is patient show very clear. So what is important point? So important exam point. There is no pocket formation because there is a necrosis of the margin level gingiva. So that means there is gingival recession rather than the pocket formation. So because the marginal gingiva die and receded, not form a pocket, so it is important to write in exam. So first, now the next one is stages of the oral necrotizing disease. So in stage 1, necrosis will see in tip of the interdental papilla. In stage 2, entire papilla is necrosis. In stage 3, which is extend to the gingival margin. In stage 4, it is reaching the attached gingiva, and in stage 5, it is extend to the buccal and the labial mucosa. In stage 6, necrosing exposing the alveolar bone. In stage 7, it is perforate the skin of the cheek. So what are the diagnoses? In spear, we found mostly organism is Fusiform bacilli and the Spirochetes organisms. So these organisms are typical in ANUG. Okay. So what are the treatment? Treatment will be stepwise. So in first visit, removal applying the LA. Then we will removing the pseudomembrane and non-attached debris after the LA. Okay. Then patient is advised to rinse with 3% hydroperoxide, which is diluted within warm water. So patient with the systemic symptoms If the patient, if systemic symptoms show, then we will place on amoxicillin 250 milligram, that is 4 times a day, or and metronidazole, which is 250 milligram or 500, that is 3 times a day, may be used. In second visit, after 1 to 2 days, after 1 to 2 days of first visit, scaling is performed and give oral hygiene instruction. So in third visit, that is after 1 to 2 days of the second visit, scaling and the route planning we will repeat it. Stop hydrogen peroxide, which is rinse are suspended, and continue chlorhexidine mouth rinse for the 2 to 3 weeks. And in subsequent visit, patient if gum healed properly, that is we review after the 1 week, and if avoid tooth extraction or surgery for the 4 weeks. Okay, should be postponed for the 4 weeks. So this was a complete and easy explanation of the NEET. If you found this video helpful, do like, share and subscribe my channel Exam 3 Point Dentistry. Thank you for the watching. So